Welcome back to our Pediatric Dentistry channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Today we are going to cover two small theories, A. Mahler's theory and B. Bronfenbrenner's ecological system theory. These are not common but important for exam point of view for UGs and PGs, and these theories are not specifically included in classification of theories of child psychology. Coming to the first theory, which is the Mahler's separation individuation theory. Margaret Mahler, a Hungarian-born psychiatrist, developed a separation individuation theory in 1933 to explain early childhood psychological development, particularly the evolving relationship between the infant and the primary caregiver. Mahler's theory outlines three major phases in the first 3 years of life: normal autistic phase, normal symbiotic phase, and separation individuation phase. The normal autistic phase is seen during 0 to 1 month. In this phase, infant is self-absorbed, minimal awareness of external world. Normal symbiotic phase is seen between 1 to 5 months, and infant begins to recognize caregiver as a source of comfort but not as a separate entity. Separation individuation phase, which is between 5 to 24 months, and child begins to differentiate self from caregiver and develop autonomy. These separation individuation phase also include 4 substages, which are differentiation, practicing, reapproachment, and object constancy. So differentiation is at the 5 to 9 months, in which child start to distinguish self from mother. Practicing, which is 9 to 16 months, increased motor skill leads to exploration and independence. Separation anxiety is present as a child still requires the mother for safety. Reapproachment is 16 to 24 months. Child seek reassurance while asserting independence if the mother's help is not successful, resulting in the temper tantrums. So crisis develops as the child wants to be soothed by the mother but is unable to accept the help. And the object constancy is at the 24 and above 24 months. So internal representation of the caregiver provides emotional stability even in absence. So the child is able to cope up with the mother's absence, and he does not feel uncomfortable on being separated from the mother since he knows that she will return. So how it relevant to the pediatric dentistry? So understanding Mahler's theory help pediatric dentists tailor their approach to match the child psychological stage. So clinical applications: behavior management. Children in reapproachment phase may show clinginess or anxiety during separation from parents in the dental chair. Parental involvement. Recognizing the importance of caregiver presence can guide the decisions about whether parents should accompany the child during treatment or not. Communication strategies. Children in early individuation stage may respond better to indirect reassurance and transitional objects like toys. Challenges are rapid developmental changes. Children may not fit neatly into one stage, requiring flexible and adaptive behavior management. And emotional sensitivity. Misreading a child's developmental stage can lead to increased dental anxiety and behavior resistance. The second theory is the Bronfenbrenner's ecological system theory. In 1979, Yuri Bronfenbrenner developed the ecological system theory to explain how a child's development is influenced by multiple layers of the environmental system, ranging from immediate family to broader societal context. He later expanded these into the bioecological model, emphasizing the role of proximal processes, means the interactions between the child and their environment, as the engine of the development. These theory include 5 nested systems: microsystem, mesosystem, exosystem, macrosystem, and chronosystem. So microsystem include immediate environment, which is family, school, peers, all the close ones. Parent and child dynamics affect the dental anxiety and cooperation. Mesosystem is the interactions between microsystems, so interactions between the child and parent, parent and teacher, parent and dentist. So dentist parent school coordination can improve the child's dental behavior. Then exosystem, it includes the indirect environment, which is parents workplace. Due to the work workplace, parents stressed out, and home environment also becomes stressed due to that stress. So stressful home environment may influence child's mood during dental visit. So there is a indirect environment. Macro system, cultural and societal norms. So cultural beliefs about dentistry shape parental attitudes and child expectation. Chrono system, time based change like divorce or relocation. So life transition can affect emotional stability and dental compliance. Applications in pediatric dentistry. So the clinical implication first is holistic behavior assessment. Dentists can better understand a child's behavior by considering family stress, school issues, and cultural background. Parental engagement. Encouraging positive parental involvement can improve child cooperation and reduce anxiety. Culturally sensitive care. Awareness for macro system influences help tailor communication and treatment plans to diverse the population. But the challenges are complexity of influences. Multiple systems interacted simultaneously, like the workplace stress which stressed the home environment, plus the relationship between the parents, plus societal norms. They all interact simultaneously, making behavior prediction difficult. Time sensitivity. Chrono system factors like recent trauma may temporarily alter the behavior, requiring flexible management strategies. So these are the references. If you want this PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll share you the PDF. New videos on Sunday. Also check out our new series of shorts, which is topic of the day, include topic Tuesday, image Thursday, and Sawal Saturday, and a lot more. So press the bell icon for every update. Like, share, and subscribe. Thank you.